On this ITP Awareness Month, to spread awareness on immune thrombocytopenia, we have one of the eminent hematologists, Dr. Sujit Kumar, consultant hematologist and BMT physician practicing at Vedanta Hospital, Lucknow. Thank you so much, doctor, for sparing your valuable time. Doctor, what is immune thrombocytopenia?
ITP is a kind of blood disorder where the body starts forming the antibodies against our own platelets. So what happens is that platelets are produced in a normal amount, but that gets destructed because of these antibodies which are being continuously produced in body. So, and that can be of two variants actually: acute ITP, which mostly occurs in children after viral infection, or it can be a chronic ITP where the low platelet counts are persisting for more than 6 months. It usually happens in children where it doesn't recover the acute ITP form, or in the adult population when the low platelet count due to ITP gets prolonged beyond 6 months of duration.
What are its signs and symptoms and how to detect immune thrombocytopenia, doctor?
Yes, the signs and symptoms are mostly related to low platelet count. So the platelet count whenever platelet count is less than 20,000, actually in that case only it is symptomatic. Otherwise, those patients who are having platelet count more than maybe 20 to 30,000, then in that case they are usually not symptomatic. And in fact, most in the population, most of the ITP cases which are detected are largely through the routine blood test, where the platelet count comes below 1 lakh and it is above 20. So in this range, the patient is not symptomatic, and by routine blood test, they detect that their platelet is low. These are the mild and moderate variants of ITP where they usually don't require treatment. However, in cases where platelet count is less than 20,000, in that case, the patient becomes symptomatic. Symptomatic in the sense that they will have bleeding manifestations from different parts of the body, such as mucosa. For example, while brushing their teeth, they will have their gum bleed, or nose bleeds can happen. In fact, in the female with platelet counts lower than 50, there you can have increase in menstrual blood flow. These are the symptoms which shows that the platelets are low. And further investigations can tell whether this platelet is low because of ITP or some other thing.
Myth or fact? Platelets can be increased with intake of platelet boosting nutriment.
There is no such evidence in literature that these nutrients will actually increase the platelet count, particularly in ITP, because as I said initially, that the phenomena is not low production. That is, production is actually normally being done. Phenomena or the low platelets are mostly because of destruction in the blood. So there is no point, or there is no recommended food that can actually increase the platelet count.
Myth or fact? Immune thrombocytopenia always causes severe symptoms.
No, as I said in my previous thing, that it depends on the platelet count. Severe symptoms are only there if the platelet count is less than 20,000. Otherwise, in those ITP patients where platelet counts are beyond 30,000, in that case, they are usually not symptomatic.
Myth or fact? There is no effective treatment for immune thrombocytopenia.
There is there are several effective treatments now available, which actually increases platelet counts to the extent that further transfusions, etc., are not required. So I would say this is a wrong statement that effective treatment is not there. In 5 to 10% of the patients, they require usually prolonged medications to hold the platelet count. In that case, actually that becomes cumbersome. Otherwise, 90 to 95 patients will recover of the platelet, will recover of these ITP conditions.